Hey, welcome to the Iowa Healthcare Association's latest member video update. We thought we would take the occasion of the conclusion of the Iowa General Assembly here about a week ago to run through a number of topics in fairly rapid fire succession. We'll start with legislative update from me, and then Cindy Baddeloo is going to take you through a number of topics, including Medicare, a Medicare update, an assisted living update, and some information on upcoming reimbursement conferences and information. Thanks for being with us. I'm going to start with our legislative update. I'm really pleased to report with what we have with respect to an outcome from the 2018 legislative session. Really proud of the Iowa Healthcare Association's staff, membership, and lobby team for what was able to be accomplished this year. General Assembly adjourned on May 5th. The session was very successful. We are still awaiting Governor Reynolds' signature on the Health and Human Services Appropriations Bill, as well as the Rebuild Iowa Infrastructure Fund bill, two bills which contain a number of IHCA priorities. Governor Reynolds has about 30 days left to approve all or part of those appropriations bills, and we'll talk about what we're doing in that interim period here in a moment. As I mentioned, I'm pleased with the association's outcomes from this session. Our success is the result of a remarkable level of engagement on the part of you members, those of you that attended 29 legislative forums, that participated in our record-breaking Day on the Hill participation this year, those that contributed to the Iowa Health Political Action Committee, and those of you that contacted your legislators. There were dozens and dozens and dozens of contacts made throughout the session, and hundreds and thousands of emails, phone calls, and the like leading up to session. Here's what I think you need to know about our primary outcomes. I'm going to invite you to peruse the May 10th legislative wrap-up email that was sent to you earlier this week that contains all the details. Couple key things. Retroactive eligibility. Top priority for the association. We have achieved the recoupment of retroactive eligibility for nursing facilities in Iowa. Language in that Health and Human Services budget bill, which again needs to be signed by Governor Reynolds, would fully restore 90-day retroactive Medicaid eligibility for residents who qualify for Medicaid in a nursing facility. It also directs the Department of Human Services to seek the necessary federal waiver to reconstitute that. We believe that eligibility should fully return on July 1 and are clarifying as much with the department. So again, I could not be more pleased with the outcome. That was a top legislative priority for the association this year, and our team was able to get that done. Nursing appropriations. We worked, and many of you know, we worked initially on exempting chronic long-term care supports and services patients from managed care. That became infeasible, understanding that the legislature was not going to move that language this year for a number of reasons. We were disappointed for about 5 minutes, but recouped, and I'm really proud of our team for working and pivoting mid-session, to find another creative funding solution that has become a hallmark of this association for a long time. So what we've achieved, again, subject to the governor's signature, is the removal of the quality assurance assessment fee statutory cap. There's new language that strikes the 3% provider tax cap that creates flexibility for the profession to consider an adjustment to that rate to generate more revenue into the state in the future. Language does not change the assessment today. All it does is remove that cap and create flexibility for us to work in the future should we pursue an adjustment. There's additional language I'm really happy with that protects the quality assurance assessment, the provider tax, for use only for nursing facilities, which will help head off the threat of other priorities scooping that money during what we're experiencing are very lean budget times. We've seen this happen in other states where that quality assurance fee is scooped for other non-nursing facility related priorities. And so we've got language which fully protects that moving forward. On the home health side, $1 million in new funding for Iowa home health agencies. This is a crucial LUPA increase for Iowa home health agencies who have seen utilization tick up but reimbursement fall further and further behind in recent years. This comes on the heels of the Iowa Center for Home Care's successful appeal to recalculate last year's devastating LUPA rebase initial proposal, an appeal which resulted in a major swing in the direction of providers, saving providers another $2 million. So a really good year for home health reimbursement. We're also very excited about a number of measures that strengthen MCO oversight in Iowa. Again, part of that Health and Human Services appropriations bill. There's language that contains at least half a dozen new managed care oversight and accountability measures, which we support and helped push through the process. A couple of those that are really important. This includes the creation of a position of a dedicated staffer at DHS who focuses exclusively on resolving provider MCO billing conflicts. This creates a standardized provider enrollment form and uniform Medicaid provider credentialing process, and it mandates a 30-day claims reprocessing and resolution timeline. Finally, another $500,000 from the Rebuild Iowa Infrastructure Fund for nursing facility renovation. That's a program since about 2005, which has leveraged more than $100 million in new nursing facility renovation projects. Renovation improvements, particularly for high Medicaid, older facilities in Iowa, is crucial to maintaining access to long-term care supports and services across our state. And so we're very, very pleased that the legislature has elected to appropriate an additional $500,000 for that purpose. I mentioned you can read about a number of other policy wins for the association in that May 10th email, legislative wrap-up email. Those include some power of attorney reform, which we helped write, which we're really happy about, hospice payment reform, and the fending off of two what would have been really, really problematic certificate of need bills. What's next? The IHCA leadership will be meeting with Governor Reynolds in the coming days to encourage her continued support of both appropriations bills provisions that I've covered here, and our Payment Legislative Committee will be meeting throughout the summer to craft our 2019 legislative agenda, and then we start cranking into our legislative forums here this fall. We will be aggressively building our capability to support those who support us throughout all this. That is through the Iowa Healthcare Political Action Committee. I urge you to contribute today to the PAC if you haven't already. We've had a tremendous amount of contribution activity and support. I want to see that going. This is a critical election year, and we've got to be active. So visit iowahealthcare.org and click on the advocacy button to contribute online today. I'm going to invite Cindy Baddeloo up to take you through some additional updates. Thanks again for being with us today, and I'll hand it to Cindy.
Thanks, Brent. For our federal update today, I wanted to make sure you knew about the April 27th CMS released their proposed rules for the Medicare SNF PPS system. With that update, first they are changing the rates that will be effective October 1st of 2018, this fiscal year 19, to go up the SNF market basket by 2.4%. This resulted in Medicare provider payments for SNFs going up $849 million nationally. Second, they propose to replace the current case mix RUGS methodology to a new system called Patient-Driven Payment Model, new acronym PBPM, and that they're looking at being effective October 1st of 2019. This proposed model is supposed to be budget neutral, but early indications looks like it will have a positive change for Iowa. And we did an analysis of the claims for 2017 for our Iowa SNF providers and looked at if this new PBPM model was effective in 2017 versus our RUG system we use today, it would have generated $17 million additional dollars for Iowa providers. The system has a lot of the same components that you started to hear about in the RCS-1 system, but with a lot of the stakeholder feedback, they modified that to go to the with the PDPM model. And then third, the proposed rules has some changes for the SNF quality and VBP programs of value-based purchasing for the Medicare payments that will affect SNFs. But watch for information over the next week, next month, and over the next year to help with providers understanding all those changes coming about with those new payment systems, both for October and also for next year. All right, for those of you who have assisted living dementia certified programs, as you know, DIA did a new interpretation of the existing rule that says all exit doors in an assisted living dementia program need to be alarmed. So if you are an ALPD certified assisted living, it's important that you review the DIA guidance for alarming doors or becoming dual certified. So you have a couple options. Either you alarm all exit doors throughout your assisted living, not just the memory unit, or for those ALPDs that do not wish to alarm on all exit doors in your general population, you can duly certify that program at its next recertification cycle. So for those not wishing to seek dual certification, DIA will extend the time frame for getting your operating alarm doors through September 1st of this year. I would highly recommend that look at the last week's bulletin. We put in there DIA's guidance if you're going to seek dual certification or about alarming your doors. So if you're at ALPD in Iowa, make sure you look at that and see what those changes are and how you can go about doing that. All right, this next month we have a lot of reimbursement conferences and education coming up that I wanted to make sure you knew of. Next week on Wednesday, ICAL is having its annual HCBS elderly waiver education, and we have some key people in there that we have the elderly waiver specialist from Iowa Medicaid is going to be here, as well as the MCOs and assisted living partners talking about the various areas with elderly waiver processes, billing, how to deal and work with your case managers, and service plan developments for waiver. Then on May 31st, we have the nursing facility reimbursement conference, a key conference for every nursing home administrator and owner operator to be at. We have a national speaker coming in to talk about the changes in the SNF reimbursement system. Also talking about the new nursing facility cost report changes that will be starting for those who have calendar year January of 2019. So those changes will start July 1st. So we have a person talking on that. Also on PBJ and the differences and the things you need to do about how to make sure your PBJ data is accurate and some operational implications that you have for that. And then, of course, we'll also have a session on how to key areas and strategies that can assist you in capturing your Medicaid reimbursement in your nursing facility. Hence, all that packed into one day with a lot of experts to come in and talk. So I highly recommend you take a look at that education. And then following in June, our summer quarterly is on June 20th. And we have specialized tracks for assisted living providers, nursing facilities, and home health agencies. And our sessions are primarily covering regulations, marketing, quality improvement, and leadership. Thanks for your attendance today. I know we went really quickly on a lot of important topics there right now. Thanks for listening. And if you have any questions, always just give us a call at Iowa Healthcare Association. Thanks.